Today we're going to talk about back pain, sciatica. So we'll kind of talk through what it is, different things that cause back pain, kind of treatment approaches that work for that, and everybody's favorite part, we'll get in a trial treatment, 5-minute miracle, we call it. So let's get started. I am Dr. Jessica. I am a doctor of physical therapy. Some of you know me, some don't. Welcome to Physical Achievement Center. Our motto is we help people achieve greater mobility and strength for their active lifestyle without medications, injections, or surgery, even when nothing else has worked. So this is me, Dr. Jessica. I have specialty training in spinal and upper and lower body mobilization. I am a fellow in training, meaning I'm completing a fellowship this year, which is the highest level of postgraduate study for doctors of physical therapy. I am a certified vestibular therapist, so I specialize in dizziness and balance among orthopedic concerns, and I am also certified in dry needling. This is Dr. Eric, the owner of the clinic. He has over 30 years of clinical experience, and he is fellowship trained, so the training that I'll have completed by March, he has completed, which makes him in the top 1% of all physical therapists, and he's had thousands of successful cases in the Oshkosh area. Dr. Rebecca is our other doctor of physical therapy. She has over 10 years of clinical experience and a fellowship of applied functional science through the Gray Institute. Again, thousands of successful cases in the Oshkosh area, and she is dry needling certified as well. We have two wonderful physical therapist assistants. This is Gina. She is specialty trained in pain relief and sports recovery massage, a certified spine specialist, and certified upper extremity specialist. And our last but not least PTA is Courtney, a physical therapist assistant with 6 years of experience. Again, specialty trained in pain relief and sports recovery massage, certified spine specialist, upper and lower extremity specialist. And finally, we've got Lori, who is our occupational therapist. She specializes in lymphedema.
What's that?
Like swelling.
Oh, okay.
Swelling.
Okay.
So she treats patients with swelling in the legs. She has over 30 years of clinical experience. She's a mentor nationwide for lymphedema treatment and has thousands of successful cases in the area. This is our whole team, minus a few newbies. So Physical Achievement Center was started to help you make better decisions about your healthcare through education and to help you heal naturally and avoid taking endless medications, endure pricey injections, surgeries, all of the things that we commonly think of in the medical field as the doctor's first line of defense, but maybe shouldn't be. So we were started to help people who are unsure, confused, or stuck and not sure what to do next for pain and weakness, and to make sure that patients are never disrespected by saying things like, what do you expect at your age? Or you just have to live with it. So the dreaded sciatic nerve. What is the sciatic nerve? It's the longest nerve in the body and actually made up of 2 nerves that split later on in the nerve. It travels down the leg and into the foot, so when it's pinched, it can cause symptoms like pain, tingling, and even weakness in the leg. And sometimes a sense of heaviness in the leg. And take a little poll. What do you think the biggest mistake people with back pain and sciatica make?
They don't move. If they are hurting, they stay real still and everything gets stiff. I guess.
Good guess. Yeah. So generally, doing nothing is the worst thing you can do with back pain. If you don't address it, it often becomes a bigger problem. You kind of said you get stiff, and additional problems come on.
Uh-huh.
So the general rule of thumb with low back pain and sciatica is the longer you've had the pain, the longer it's going to take to get complete relief. So it's important to address things early on if you can. And if you are later on, there's still hope. What is the biggest mistake? Number 2 is to mask the pain with over-the-counter or prescription medications, braces, pain gels, creams, anything that looks like you're kind of hiding the pain without fixing the root cause is another common mistake. It might feel better momentarily, but when the effects of that wear off, the problem is still there. And ignoring a more holistic, comprehensive treatment that looks at you as a whole person, managing all aspects of your lower back pain. A lot of people hope for just one single solution to their pain, that silver bullet that'll hit everything and make the pain never come back again. So by ignoring holistic treatment, you're missing out on living comfortably and confidently in your active life. And finally is relying exclusively on surgery or injections to get you back to your active life. It usually takes a more comprehensive approach than that for long-lasting relief of symptoms. So there's a couple ways that people handle pain. The first one is to ignore it. Sounds like excuses. Second is to alter it. That looks like your pain medications, your creams, that mistake that we just talked about. And finally is to handle it, which is, I think, what we're all here to do, see if we can find a way to handle the pain. So, most common causes of low back pain and sciatica. Number 1 we'll talk about is a herniated disc. So with a herniated disc, patients have increased pain with bending forward, twisting, coughing, or sneezing. Basically, when we perform those motions that either flex us forward or create additional abdominal pressure, it pushes the disc backward onto that nerve. It's kind of pictured there in red. That sciatica pain that comes from a herniated disc is usually sharp and runs right down the back of the leg. And traditionally, we think of individuals with a herniated disc as being 40 or younger, but that's not always the case. There is relief with bending backwards or standing, those movements that create extension of the spine, which complements that increased pain with bending forward. So this is a little bit of what sciatica from a herniated disc looks like, showing an example here of this disc bulging out in the backward direction and pushing on the nerve, and the red here shows a common distribution of where those symptoms would be. Another common cause of that is arthritis or stenosis, and kind of the opposite, these patients will have pain with standing or walking. Stenosis and arthritis generally affects older individuals because it comes from a degenerative change at the joint, becomes more common with aging. These patients often have relief with sitting because the narrowed space from the arthritis kind of opens up as we flex the spine forward. Next is muscle instability, and that often presents as a painful catch, pain with changing positions, difficulty getting up from bending forward. We see this sign of people kind of walking their hands up their legs when they want to get up from bending forward. And this is something that's not going to show on imaging. So we can only detect it with proper examination and history. An X-ray, MRI, or CT isn't going to show muscle instability, but many back pain sufferers have it. Nerve pain and irritation. is often a pain that seems to never go away. Even with very little activity, you can get long-lasting pain. And again, irritation of the nerve isn't going to show up on any imaging, so it's really important that we examine patients thoroughly to find out what's contributing to their pain. Something about MRIs and X-rays that many people don't realize is that they aren't perfect. We often use them as the gold standard, but correlation of imaging findings and pain are not as clear as we like to think they should be. So this is an interesting study that was done in 2014 looking at lumbar spine MRIs and CT images of healthy, pain-free individuals in varying age ranges. So down here is people in their 20s, up here is individuals in their 80s. You can kind of choose the one that best matches your age range and follow along. But the blue shows the incidence of a disc degeneration. And you'll notice that blue bar, and by age 80, 100% of images are going to show disc degeneration, even in asymptomatic individuals. So if you had an image that showed disc degeneration, is that 100% the only cause of your pain? There's plenty of people who have disc degeneration without pain. Even in their 20s, over 25% of asymptomatic individuals have some disc degeneration on imaging. Same with a disc bulge. Look at patients in their 40s. About 50% of individuals have a disc bulge without symptoms. Disc protrusion, so more severe disc bulge, are similarly a little less frequent but still common. Facet degeneration, so that's kind of arthritis and degenerative changes at the joints in the vertebrae. Again, that yellow bar is all too common in individuals of all ages, so just degenerative changes doesn't always equal pain. And finally, spondylolisthesis, and that is the slipping forward of one of the vertebrae on the other. And again, by age 80, 50% of asymptomatic individuals have these findings. So we question how golden is the gold standard. So it's worth considering that a thorough examination is maybe even more important than the imaging that often patients get. We've got a couple bonus causes of pain. And this one I see very frequently tied to back pain is a tight and inflamed hip joint. So we have this kind of conundrum in diagnosing because pain can refer from the hip to the back or from the back to the hip. Often the two are interrelated, so it's worth a thorough examination because pain isn't always what you think it is. And this is something that doesn't show up on your imaging, so it's important to get a thorough examination. We can often treat patients' low back pain by taking approaches such as mobilizing or strengthening their hips, and that's because the two are so interrelated. Another bonus is the TL junction, so where the thoracic spine or upper back meets the lumbar spine or lower back, and this is also called Maims syndrome. This photo is a really good summary of how that Maims syndrome works. It's not going to show up on imaging, but this area can directly refer pain to the low back, to the buttock, and even to the groin. So by treating that area where the thoracic spine meets the lumbar spine, we can treat hip pain if that's where it's coming from. So that's, again, another explanation for looking really thoroughly at patients as a whole person, not just exactly the one area where their pain is. Piriformis syndrome is a condition where the piriformis muscle, which is located deep in the buttock region, becomes tight and compresses the sciatic nerve, which passes right next to or sometimes even through the muscle. So this is a good photo of how close the two are. You can imagine when that muscle is tight and pushing on that nerve, it can create some of the same sciatic symptoms that we're all too familiar with. And symptoms may include pain in the buttock region that can radiate down the back of the leg, can include numbness and tingling in the leg, or even weakness. So, little survey. Is it possible to have more than one issue?
Yes.
Yeah.
Almost always. Almost always. So, can't reiterate enough the importance of looking at an individual as a whole person. Alrighty, everybody's favorite time of the night is our 5-minute miracle. Do we have any volunteers who would like to come up and see what's going on?
Yeah.
I saw 2 hands fight it out.
I get the miracle every time I come
I'm familiar with your
here,
back,
so.
so I might pull the new face if that's okay with you. If you want to come on up.
Oh,
And just remind me of your name.
Chris.
Chris. All right, Chris. So I'm going to start by taking a look at your back, a little examination to see what brings on symptoms. So if
Okay.
anything does, I want you to let me know. If anything makes things feel better, let me know. First movement we're going to go through is just bending forward, reaching towards the floor as far as you feel comfortable. Good. And come on back up. Any increased pain with that?
Coming up.
Okay. And bending backwards here. How does that feel to you?
Not too bad.
Okay. Not too bad.
Just tight.
And bending to each side. Really to the side there. And to the other side. And you said your pain is mostly in the form of like a muscle spasm?
Spasm, yeah, so you're right about it in there. It's actually a little raw.
Any other related symptoms outside of that area?
Not really, no.
Okay.
That's been the major problem right there. Having
Yeah.
that little muscle.
And how long has it been going on for?
Almost 10 years. I've
Any
gone through
treatment?
chiropractor. I had a shot put in through the back to the hip.
Were any of those effective?
It was great. The shot was great for 6 to 8 months.
That's often what we find is it masks the pain really great,
Mm-hmm.
but then the pain comes back because you didn't fix the root cause.
Usually worked for the most part.
Okay.
Was helpful, but it never really got rid of it either.
Yeah.
So, but the back spasms are the big problem right now.
Yeah. How often do they happen?
Here and there, depending what I'm doing, or
Sure.
I mean, I could be fine and all of a sudden be on the ground.
Yeah. Yeah.
So
Is it pretty predictable or random when they come
it's
up?
random.
Random.
Yep.
That's hard to deal with.
Yeah,
And I assume you would
Just-
like to live a pretty active life.
it would be nice.
Yeah.
Or I try to as much as I can.
Yeah. Well, I'd like to pull up a little massage chair here. Is this yours? Grab us a towel for the hole here. Just 1 minute. So we'll get you on this table here. Yeah, that wouldn't work too well, I guess. So knees will go on those pads there. Good. And arms kind of rest here, face in the hole. Does that feel like a comfortable position for you?
Yep.
More or less?
Mm-hmm.
So I'm going to start just by assessing mobility of your spine. I want you to let me know if anything increases symptoms or if anything alleviates symptoms. So nothing into the hips.
No.
How does that feel?
I can feel pressure there.
Painful pressure or just pressure?
Just pressure.
So this is a joint mobilization technique that kind of doubles as treatment. And assessment. And a little bit of tightness in there. No increased symptoms.
No.
Is it only on the right side?
Usually, yeah.
Is there any predisposing injury?
No, they said there was no damage, according to pictures.
Yeah, you had X-ray, MRI.
Mm-hmm.
Actually, they did that before. And when was the most recent cortisone injection?
Oh boy.
Years ago?
Yeah, it's been a while.
And do you generally find relief with massage, manipulation?
More the chiropractor, the rubbing like they usually kind of do, and
Yeah.
kind of like what you're doing.
This is my first approach for something like this, but I like to, as I was mentioning, take a multi-directional approach because it's very, very rarely just one thing. Be curious in a full evaluation to take a look at your hip mobility to see if that plays a role in your symptoms. Is that a little tender?
Mm-hmm.
Tolerable tender or kind of
Tolerable,
reproducing?
yeah.
Okay. So I think based on how your symptoms present, it's fair to assume that a muscular cause is your primary cause of your back pain, but there's some areas that are a little tight that might benefit from mobilization to get all of the segments moving appropriately. And be curious to take a look at hips and the global strength of the region. Also be curious how a back like yours might respond to dry needling. Have you ever considered or tried anything similar to dry needling?
Yeah, we've talked about it.
Thoughts about it, positively or negatively? Questions?
I'd be willing to try. I'd try anything.
I think it's something that you'd likely respond well to with the seemingly muscular nature of your condition. There's definitely a lot of things that we can do without dry needling, but I think that it speeds up the recovery in a lot of conditions like yours. Feeling okay with my pressure?
Mm-hmm. It's a little sore right in that area.
Yeah, seeming a little stiff in that area as well. What kind of active things do you hope to get back to, or do you push through the pain to do?
A lot of times I do bowling and golf, but just to be able to move and do a few other things is nice.
Yeah.
bowling and end up with a back spasm, just fight through it.
Yeah, that's no good. Making sure that your mechanics as you're doing those things and your mobility and strength support the demands of those activities would be an important part of a more comprehensive program. Let's get you sitting up here, or standing up, I should say. That job. And notice how you feel with bending forward. A little further. How's it coming up?
Not too bad. A little bit better.
Good.
Easier.
Good. And backward.
Yeah, that feels good too.
Good. A side bending motion. Then a little looser, a little freer in that
Little
direction.
loose, yeah.
Yeah.
I think a little bit.
And I'd be curious to see how you do with a more zoomed out, comprehensive approach that
Mm-hmm.
looks at all of the aspects of the back. I think this is a great starting point,
Mhm.
but zooming out is really gonna help us to get things
Right.
back to 100%.
That
So,
would be nice.
Thanks for volunteering.
Thank you.
Alrighty. So, question is, when is it time to consult with a doctor of physical therapy? And I think anytime that pain is interfering with your ability to sleep through the night, if it's keeping you from dressing, housework, gardening, yard work, travel, any activities that you like to do, if you aren't able to do that thoughtlessly and fearlessly the way you used to be doing, it's time to have a consultation. If you're fearful of losing your independence because of your pain, it's definitely time to seek help. We don't want you worrying about your pain. We don't want your loved ones worrying about you. Or if you find yourself massaging and slathering on pain ointments or getting repeated treatments without really making a change, or you want to just stop spinning your wheels and living with this pain that you've had for 10 years.
10 years almost, yeah.
If you're interested in minimizing the drugs, injections, and surgery, and you want to eventually learn how to self-manage and not be reliant on continued treatments for your problem. So as modern evidence-based doctors of physical therapy, we will provide pain relief through joint mobilization, a little bit of what you saw here, manipulation when it's appropriate, or cracking the joints, providing massage work for pain relief and increased mobility, develop an exercise prescription based on your individual needs, whether that be mobility or strength. It's always specific to you at your given phase of recovery, a little bit more specific than what Dr. Google might give you. And help you to develop a strengthening program to get you back to your active life. Again, that's not going to flare you up, but going to help you to reach your specific goals. We'll provide pain relief through dry needling if you're interested and if it's appropriate for your condition. And finally, a modern evidence-based physical therapist should be the provider of choice for non-surgical and non-drug prescription care, using all of the best tools and a comprehensive holistic approach to get you to your goals. We think about a plan of care as being 4 phases. Oftentimes when patients come in, they look like that guy in red. And the first thing we need to do is relieve that pain and inflammation, get them feeling better. After that, we quickly move to stage 2, which is to correct the root cause of the issue so that it doesn't come back. Then we want to progress as pain levels lower. We want to get people stronger. And finally, we want to give an ongoing independent management program so that you can preserve your gains so that this doesn't come back, or if the symptoms start to peak back, you have an idea of what to do to solve them before they get bad again. We have a lot of patient testimonials. I think some are included on your clipboard, so I won't read through all of these word for word, but lots of patients have had success with physical therapy here, and we have a bunch of Google reviews if you're interested in seeing some patient stories. Our promise to our patients is that you will receive a natural healing based treatment using one-on-one hands-on treatment with a doctor of physical therapy. You will get individualized exercise programs to strengthen your back, hip, and legs. And all of that without medications, injections, and surgery. And we're always happy to discuss supplement and lifestyle recommendation as it applies to you, because as we zoom out, you are a whole person, and what you put into your body can also contribute to how your body performs. So where do we go from here? The easiest way to get started is with a free discovery visit. So each of you has on your clipboard, I believe, a golden ticket. Maybe not?
Maybe
Yes.
not, but I can get some.
So with our free discovery visits, each patient will get 30 minutes of undivided attention, finding out the cause and solution to your pain and mobility concerns. And it's a $175 value that's free to everyone in attendance today. So we don't collect money for this. This is purely so you can figure out the cause and solution to your pain. And sign-ups will take place up here. So we've got dates and times listed here, organized by date. And what you'll do is select a date and time from the available time slots on the wall and head up to the front desk with your time slot, your insurance cards, and the receptionist will help you to finalize your appointment. Any other questions for me before I hand it off to Lisa?